My guest today built a program around what causes someone to seek alcohol or substances, rather than just managing addiction. This innovative treatment philosophy led him to pioneer one of the most recognized treatment models in the country. Pax Prentiss is the co-founder and CEO of Passages Malibu, co-author of The Alcoholism and Addiction Cure, and has helped more than 40,000 people get sober. Today, we're talking about what actually causes addiction and what real recovery looks like. Welcome, Pax Prentiss, to the Love You Even More podcast. Pax, I am very happy to have you on. I am so glad that you reached out because not only do I want to talk to you about addiction and not just substance abuse, which we'll absolutely get into, but also like what really causes addiction, which you are an absolute expert on. Being the CEO of Passages, like you have been at this for a really long time. Plus, you have your own personal story of addiction that, if you'd like to share, I think would really touch a lot of people to know, you know, you get it. You really get it, which I think a lot of people going into addiction treatment are like, do you even understand this? Like, and I want to know if that's actually like an issue with therapists or if it's not an issue in treating. But
Yeah, well, thank you for having me on your show and happy to talk about anything that your audience might find interesting. Certainly, addiction related topics are my expertise and also sobriety. So,
which
yeah.
go hand in hand, hopefully. That's what we're
Yeah.
aiming for.
Yes.
So maybe we start with your story. And you were addicted to heroin for a time.
Yes.
How did that start?
So I was addicted to heroin, cocaine, alcohol for 10 years. I started using kind of recreationally when I was 16. Uh, and then I got into heroin use around 18.
Mm.
And then I got sober when I was 26. Yeah, so I actually got sober quite young.
Yeah, I was
Most
just
people
thinking
get it
that.
a little later on.
I have a question. I actually have a friend who was sober at a very young age too, and then later decided to start drinking wine. And he was like, "Oh no, it's just, I'm kind of like thinking of becoming a sommelier." And I was like, "I don't know, this just feels like sort of a slippery slope." And his idea, and I know that you have thoughts on this, I know you will. His idea was, oh, maybe I just was a kid and I was just doing a bunch of stuff and just partying. Maybe I wasn't actually addicted. Maybe I got sober when I didn't need to get sober. What are your thoughts on that since you did get sober early?
Yeah, so we teach people to stay sober completely. So once you've been addicted to a substance, whether it's cocaine, alcohol, crystal, heroin, fentanyl, I don't recommend that people go back to drinking alcohol because it will usually lead them back to whatever their substance was that they were using.
Right.
Um, the thing about alcohol is it really it actually creates cravings. So if you once you start drinking, a lot of times people get an urge to like do cocaine or do some other substance, but it gives you this feel this kind of loose and warm and kind of feeling, and your guard drops, and
Mm-hmm.
it just it- it's not it's yeah. Once you've
Yeah.
had an addiction, it's really a good idea not to go back to drinking alcohol.
I would agree
Yeah.
with that.
Yeah.
I just, I mean, even when I like
Yeah.
do drink, and I actually don't drink a lot at all. I never have, but I'm always like, I'm hungry for French fries now, which is so not the same, but it's a craving of some kind.
Yeah.
It leads to not great decisions,
Yeah.
but
I'm still yet today to meet someone who's told me that, hey, I went back to drinking recreationally and that's working for me. Usually, like once you've had that drug addiction or alcohol dependency or what have you, you really need to remain free of substances.
yeah, yeah.
Um, yeah.
So when you got sober, when how did that happen for you? Like how did you finally say like, okay, this is enough. I need help. And how was that kind of journey for you personally?
Yeah. So if it would have been up to me at that time, I would have kept using. It
Mm-hmm.
was really my dad that intervened and was able to get me into treatment. Uh, heroin had its grips on me. It had its claws in me. It's a very addictive substance.
Yeah.
And if it wasn't for my dad really stepping in and basically forcing me into treatment, I probably wouldn't have gone. The only issue that I was really running into with on the treatment side is that at that time, the only programs that existed were more group based.
Mm.
And so it was more focused on the 12 steps and on looking at addiction as a disease and that you're an
Mm.
addict or an alcoholic. And that methodology never worked for me. And so I would always relapse after treatment. And that went on for a number of years. And it was my dad he really came up with the concept of, I think there's an underlying condition to why you're doing what you're doing.
Wow.
And so when he started talking to me about that over and over again, about why do you think you're using heroin? That's when I started to do some more deeper reflection. And it was that way that I was able to really get in touch with some of the underlying issues that were causing me to use. And then instead of doing like a regular treatment program, I went into a lot of therapy, like one-on-one type therapy with a variety of different therapists that was geared more towards treating these underlying issues. And that's really what changed everything for me. But that's kind of a long-winded answer of it was my dad who was
Yeah.
ultimately the one who got me into treatment, but more importantly, came up with a different philosophy for treating me,
Right.
for which is what worked for me. And it's what
And
led me to starting Passages. So,
yeah, well, and it's because the like traditional idea of addiction being a disease is that I have this disease, I I what? Like I just have it forever and that's it. Like what is the old fashioned or maybe traditional view of what addiction is?
yeah, so traditionally, I think it was in 1956 that the American Medical Association viewed addiction as a disease. They said it was a disease. Um, and I think primarily the reason they did that was to get the insurance companies to be able to pay for the
Right.
treatment because there were so many people that were suffering from it.
Right.
And then, of course, there are lots of studies out there that will point to changes in the brain that take place
Hmm.
after you've been addicted to a substance for a long time. I'm not necessarily going to say that those changes don't happen because I think if you're using any substance for a long time, there's going to be neurochemical changes in the brain.
Totally.
However, to say it's a lifelong disease, I don't necessarily get on board with it. And the reason being is I think it stops people from looking for the real causes of the dependency.
Mm-hmm.
So I like to look at addiction more as a symptom. And then if you look at it more of a symptom of like depression, anxiety, stress, trauma, then it focuses the treatment on what those underlying conditions are that are causing the person to seek substances.
Right.
Where that if you just fall back on it's a disease and you're an addict or an alcoholic and you're powerless, then it doesn't really lead you to the solution other than how do I manage it?
Right.
So I like to get more into it's a symptom. Now, in saying that, I don't recommend people ever go back to using drugs or alcohol because if they do, I do believe they will become addicted again.
Yeah.
And is that because of a disease? I can't really say one way or another, but I do recommend that just people do not use after treatment. Yeah.
I think that is great advice. And they
Yeah.
probably know that too. I think, I'm just trying to like be in the mind of an addict. Like it feels so good to not feel bad when you're taking a substance,
Yeah. And I
you
think
know?
anyone could say that. I mean, when you
Right.
feel bad, you naturally want to feel better, whether that's personal pain, psychological pain, physical pain.
Right.
The idea is to get away from it. And that's why people go to substances because in the short term, it works. I mean, there
Hmm.
is a relief experience when you have a drink or you
Hmm.
do some coke or whatever it is. But the long-term effects over it, especially with prolonged use, is that you develop all these other consequences that go along with it.
Right.
But it's originally why they're reaching for it is for relief.
Absolutely.
Yeah.
And then were you like kind of the beginner of seeing this as a very different way, like seeing addiction in a very different way other than a disease? Were you one of the first people to see it like that?
Yeah, so Passages was our program was the first individualized holistic treatment program where we offered all these different types of therapies to focus on the underlying condition.
Right.
Um, and when we opened, we got out of we're not going to label you an addict or an alcoholic because we don't want that to define who they are. We don't want
Mm,
that to become their identity. We want to look at you as a perfect whole person, but you're not completely operating at your full potential currently. So what we want to do is get you to the authentic self. So
mm,
the idea is to like not tarnish them with the labels, not tell them they have a disease, not get into like some of these other heavier concepts, and really
right.
just look at them as an individual and say, look, at you have an authentic you,
Yeah.
like the best version of you, and we want to align you to be more of that person. And in order for us to get you there, we need to treat these underlying conditions which are holding you back, and then basically set you up to start working on becoming the true best version of you.
Right.
Yeah, the authentic you.
Yeah, I think that is personally, I just think that that's a much more realistic view at helping someone too. Because I think when you do label yourself something and you do say, "Well, I have this disease," it does feel kind of victim-y a little bit, and it feels like, oh, like you said, like I can lean on that, and well, I'm just an alcoholic, or oh, I'm just an addict. It's like,
Hmm.
yeesh, even just saying that, or like the idea, I guess, in AA is like, I'm always an alcoholic. I'll always be an alcoholic. It feels really damning to me.
Yeah. Yeah, I used to run a commercial on TV. It was up for years. And I said in the commercial, I used to be an addict and now I'm not. And so I used to get a lot of like criticism from that, from the 12-step program specifically,
Yeah,
that people would call Passages and say, they would complain that no, once you're an addict, you're always an addict.
right.
And that's really where we differentiate is that we're really moving beyond like, we don't want you to have an addict mentality or an alcoholic mentality. The idea is
Mm,
to find out, who you are as a person, what your qualities are, what your talents are, and to have you step into those,
right.
and leave the old life behind where in some programs I feel like they're kind of dragging it with them. Like
Mm,
this is what I did, and so this is who I am,
yeah,
right? So it defines them
right.
rather than, hey, this is what I can be, and this is what I want to be, and I'm going to go out there and become it.
I love that. Are
So,
there specific like therapies or modalities that you're using at Passages to help people sort of discover who they are outside of being an addict? And if
mm.
you have those, what do those look like?
Yeah. So I know you're a marriage and family therapist. That's one of the things that we do at Passages. So when a client checks in, they're assigned a treatment team that
Mm.
works with them privately. And so that treatment team consists of a medical doctor, a psychiatrist, a psychologist, a marriage and family therapist, a hypnotherapist, a
Ooh.
spiritual counselor,
Oh,
a chemical dependency counselor, a massage therapist, an acupuncturist, a physical trainer, and an aftercare planner.
I would
So,
like to sign up. Sorry.
yes.
That sounds
So that
great.
whole team works with them one on one each week, that
Wow.
entire team. And the idea is that we want to focus on like the medical, the clinical, and the holistic so that we can treat the whole person, body, mind, and spirit. Yeah.
I love that.
Yeah.
Um, your patients are very, very lucky to be with
Mm,
you. Let's talk a little bit about addiction itself. We all obviously know, like in this conversation, we do not see this as a disease or this is not forever like a label that you need to have. But when we think about addiction, obviously you have marriage and family therapists and psychologists digging into a person's life and the people that they have affected, but also the people that have affected them to create said addiction. What is it that people need to know listening if maybe they have a person in their life that is an addict or maybe they are an addict? Because it's really hard to know what to say, how to approach that person, or if you are that person, to even admit like the feelings that you've been stuffing down of I don't
Mhm.
want to look at the things that have happened to me. How does someone actually like talk to that person, or if they or that person like start to actually admit like I really do need some help? If any of that made sense, that was a lot.
Yeah, well, the one thing with the families, especially like if you have a family member or a loved one who's struggling with drug or alcohol abuse, you have to be mindful not to step into like the enabler position.
Mm,
Because if you ignore it, or in some ways, like if you support it, whether that's financially, whether
mm,
you're housing them, feeding them, supporting them in some way, you're allowing the behavior or even supporting the behavior, even though that's not your goal,
right.
right? So you want to really step in and take action, decisive action, to convince that person that they need to go to get help
Yeah.
and turn their life around. And if a family is not able to do that on their own, like really able to take control of the situation and get the loved one into treatment, then they need to work with an interventionist, because an interventionist is someone who's trained to organize the family in such a way where they can do an intervention and help get the person into treatment. But
Absolutely.
they need the number one, and I see this quite frequently, is families just waiting too long or not being willing to take the necessary steps to just get that person the help that they need.
Right. Because you
Now,
miss. Oh, go
yeah,
ahead.
yeah. And then on the flip side, if somebody is considering treatment or they need treatment for themselves, um, the best thing is just to call and talk to a facility, can call Passages and talk to one of our admissions coordinators. Doesn't mean that they have to commit, but once they hear what the process is like and they get a feeling for what life is going to be like after Passages, after treatment, they will get there and wish they would have done it 10 years sooner.
Mm,
It's really just how much better is their life going to be once the addiction is behind them and they're stepping
yeah.
into their authentic self.
Absolutely.
Yeah. Yeah, yeah.
It's just, I've worked with addicts before, and it's so sad because they hate themselves on so many levels. They feel so much shame and guilt, and it does eat up so much of their lives. And I think it would be so hard to try and to feel like you're failing at treatment.
Mhm.
And how does someone really get through treatment and then get to the other side and they're like, okay, now I have to do this like on my own. I
Yeah.
have to stay sober. Kind of walk me through that.
That's a really good point that you raise, because a lot of times the person that's like alcohol or drug dependent, they hate themselves so much, or they're so upset with themselves that they feel like they can't really do it for themselves. And you'll
Right.
hear a lot that you have to do it for yourself, when in reality you can choose to get treatment for somebody else. So what I mean by that is, like, let's say you have a son or a daughter and you want to be a parent to them. If
Mm-hmm.
you feel like you can't do it for yourself, do it for your kids, or
Yeah.
do it for your husband, or do it for your wife. A lot of times it's easier to say, okay, I want to take this step so that I can be a better, significant other or father or mother.
Yeah.
And then what happens is, over time of being sober, they start to feel so much better, and then they're doing it for themselves.
Right.
But if you can't do it for yourself, like, do it for somebody else. Which
Uh,
is, when I got sober, my daughter was one,
oh.
and I was a single parent. And so that was one of the driving factors, is that if I wasn't sober and healthy, my daughter wasn't going to have a parent,
Yeah.
because her mom and I never, we didn't stay together. The relationship parted ways because she was going through her own problems. And so
Right.
I was the one there to be the parent.
Yeah.
So I did it more for my daughter at that time than I was even doing it for myself. But hey, it was a good reason and I used
That's
it. So
that is such a good piece of advice, and it's not that hard to do. I mean, it's really not. You've got to find someone you care about, and then honestly, just do it for them. Um, Let's talk a little bit about, because, we always think like substance abuse is, addiction, but let's talk about addiction in a couple different other places like sex addiction or gambling and how that looks similarly to just regular substance abuse.
Well, the way I look at sex addiction or gambling is that it's a symptom. Just the way I look at drug use or alcohol use, it's a symptom of an underlying issue,
Mm,
right? And regardless of what the behavior is, whether it's drug addiction, alcohol addiction, sex addiction, gambling, people are looking to find relief from some sort of suffering.
right.
And so, I mean, even with something that like gambling, even though you're not necessarily doing a drug, you're still getting and experiencing euphoria.
Right.
There's still dopamine and serotonin hits when you place the bet or when
Mm-hmm.
you win,
Mm-hmm.
which do relieve you from stress.
Absolutely.
Um, Same thing with sex addiction. I mean, and sex addiction is kind of like a lot of times misunderstood, but it's like when an individual is having really they have multiple partners and they're usually out. There's a lot of pornography involved with it or paying for sexual services.
Mm-hmm.
But it's not, necessarily I'm having lots of sex all day long. It's more like the behavior of the sex addiction,
Mm-hmm.
which is associated with risky behavior. Um, but they get, once again, they're getting euphoria from it.
Right. Right.
So it's just a way of relieving pain.
Absolutely. What do you think the future of addiction looks like?
That's a really good question. It's changed a lot in the last 10 years because, heroin used to be really popular back in the 90s, and now it's being replaced with fentanyl, which is
Mm-hmm.
a much stronger drug. It's a much more deadly drug.
Yeah.
Um, so you get a lot more overdoses
Yeah.
than you did with heroin. And now it's actually difficult to find heroin. I mean, it's around, but I used to check people
Wow.
in for heroin addiction all the time. Now I rarely see it.
Oh, wow. How interesting.
Um, but things that are on the rise, I mean, fentanyl for sure, but then also ketamine.
Yep.
So ketamine is legal. You can go to a particular clinic and get it prescribed for you or have it administered at the clinic as a way to treat depression.
Right.
And I'll tell you personally, I have not seen success with anybody who's using ketamine for depression treatment. That's
Interesting.
just me. However, on the flip side, I see people checking into passages on a regular basis for ketamine treatment. I'm sorry, for ketamine addiction.
Huh.
And it has harmful side effects, one of them being issues with the bladder and the urinary tract. It
That's not good.
irritates it. And so it causes really serious issues there over prolonged use.
Oh, wow.
Um, but yeah, I mean, different drugs come in over different times and you just start to see different things. But the nature of addiction, I think, is that it's always going to be present, it's always going to be around. Um, yeah,
Yeah.
yeah.
I think it's interesting with the younger generation. They're really not drinking. They don't want to do drugs. Not all of them, obviously. But a lot of them are just kind of going more towards this sober life. What are your thoughts about that?
I think you're right about that, actually. I think and I can't put my finger on why that is, but I think there's more and more young adults that are not drinking
Mm-hmm.
and potentially not even doing drugs. However, recreational marijuana is still pretty prevalent. But,
That makes sense.
and
Yeah.
by the way, that I will go on record here and say that drug causes a lot of issues with mental health.
Mm-hmm.
So I have a lot of young adults which are using marijuana for the first time. So they're 18, 19, 20, 21, and they will develop a very acute mental health condition, even
Wow.
as acute as like schizophrenia or obsessive compulsive disorder or other types of mental health issues just from smoking marijuana.
Do we know
So that's,
why?
I mean, I can't, one of the reasons that it might be is that the THC content is so much higher.
Mm-hmm.
So THC content used to be like between 5 to 15%. Now it's like 15 to 30%.
Mm-hmm.
So it's like twice or three times as intense. Plus, there's different ways of administering THC. They have all these different things like gummies and
Yeah.
right. So
Yeah.
I just think marijuana is a really it, it's very accepted, but also very dangerous. And I don't know if it really gets the reputation that it should, which is marijuana is a dangerous drug.
Well, it's interesting because people are always like, it's the gateway drug, or at least I grew up hearing that. And I do believe that. Like, I do. I think it's just like drinking. It's a great gateway into other things. It's
Hmm.
just very accessible. And you're right, it's much stronger than it's ever been. And it's, especially in California where we're both at,
Hmm.
it's very accessible. I mean, just on my street alone, there are like 3 dispensaries I could walk to. Like, one's in
Right.
front of my house. And
Yeah.
it's, well, there's actually two now that I think about it. And it's just prevalent and it feels more like you're going to a bar, but it's just marijuana.
Yeah.
So yeah, it has a much more accepted and almost like healthy. Like it's if we're gonna do drugs, let's do the
Right.
healthy drug.
Right. Right. And it's interesting because marijuana has been viewed as a gateway drug, but I always tell people it's actually the drug
Ooh,
because people say, okay, well, it could lead to something else. Well, that's true, it could, but the problem is that they're doing marijuana. That is actually a really bad drug.
yeah.
I'm checking people in for just plain marijuana addiction.
Wow.
And a lot of times it's associated with mental health issues
So let's
that
talk
were
about
caused from the marijuana use.
so we're talking schizophrenia. What other things are coming up?
So bipolar,
Mm,
OCD, borderline personality disorder, anxiety,
yeah.
depression. And these things were actually not present prior to them smoking marijuana. And
Mm,
then after smoking it, sometimes even just one time or a few times, they start to develop these mental health issues. Now, I will say I see it more in young adults, like 18 to 25, not so
okay.
much in adults.
Okay.
Um, but, and this is like a really common effect. And, maybe 1 in 20, 1 in 30, I'm just sort of guessing here. I mean,
Mm,
so it's common enough where it should be considered a dangerous drug, just because, maybe some individuals smoke it and don't have those results, but they have some other type of issues. But yeah, I mean, the marijuana is just, it's not safe.
yeah.
Yeah, it's just
It's
not.
That's such an interesting fact. I think a lot of people would be surprised by that because, we just always hear, like, oh, it's
I
fine.
hear it all the time, all
What
the
I've
time.
interviewed quite a few people who do psychedelics and, praise them and think they're the best. And we have a lot going on now with like psychedelic use to like help depression and anxiety, etc., that is administered by therapists or psychologists. What are your views on the future of that or just that?
Psychedelics they're here and they're gaining in popularity. I'm yet to see someone go and do a psychedelic trip, whether it be ibogaine or some other type of psychedelic, and come back and say that they stayed sober and that they were healthy, happy, and free of drug addiction.
Okay.
I haven't seen it personally. I have heard of people who have had success using some psychedelics for treatment of trauma, um, in some cases. However, for treatment of like just drug addiction and the underlying conditions that could potentially cause it, I don't see psychedelics as a solution.
Yeah.
And I've oftentimes had clients who have done that, and not had the type of success they were hoping to have because
Yeah.
it's, you know, to to change your lifestyle, the way you live, the things you do, the way you think, the way you view drugs and alcohol. I mean, it's more than just having a psychedelic experience. I mean, this is a complete life change.
Right.
And, we're talking about keeping somebody sober for the rest of their life. So 30, 40, 50, 60 years of life,
Yeah.
um, which takes concentrated individual therapy focused on really bringing about that change, which is
Mm.
very doable. but just from doing like an 8 or 12 hour psychedelic trip, I haven't seen it.
Yeah.
I haven't seen it. I mean, there's a lot of people that will argue that it's the solution, but I haven't seen it.
Do you think people could become addicted to psychedelics?
Not in the same way that they will like alcohol,
Okay.
or an opiate or prescription medication. And the reason being is in most cases, you're not going to do psychedelics every day.
Right.
Like when someone does psychedelics, maybe they're doing it once every few months or once a year or once every few years to have some sort of a breakthrough. They're looking for that breakthrough.
Right.
But with other types of substances, you use it every day. And that's really where the addiction becomes, because in some cases, your body becomes physically dependent, meaning if you stop, you go into withdrawal.
Right.
So that's not going to happen with psychedelics.
I guess I was thinking of like a microdosing, but if it's a
That's a
microdose,
little different. Yeah.
yeah. The other thing I've heard too is that people who do some sort of psychedelic experience, they also can have psychotic breaks or develop schizophrenia or suddenly have like bipolar, and they did not before.
Yeah. Um, the microdosing that you just touched on, yeah, that's something that people do on a regular basis, which some people have heard say that help them with their depression. But um, if you have a drug addiction, I don't see how microdosing or psychedelics is going to get you through that.
Yeah.
Um, but on the, I'm sorry, what was your question there? You said, I just want to make sure I
Oh, it was
answer
just
it.
more of a comment of like, some people have done like psychedelic experiences and they've had psychotic breaks
Oh,
after.
psychotic breaks. Yeah.
Yeah.
Well, it happens.
It just
You
happens,
know,
guys. That's it.
yeah, I mean, that happens as well. What's interesting is that even with drugs like heroin or cocaine, you don't hear that so often that they have psychotic breaks. And I'm not
Right.
recommending that people go out and do those drugs because I'm not. But
Yeah.
the ones where I hear it more is with psychedelics and marijuana,
Yeah.
which are two of the drugs that are getting more popular as a way to treat um, depression or trauma. But I don't think there's enough attention on what those actually can cause as well.
And I think just wrapping back to what you were originally saying is that this is not, it would be amazing to go do a psychedelic experience, have this amazing breakthrough for trauma, but you're not going to come out a totally different, brand new person, brand new healed person who's like, I'm not addicted, I'm not upset over anything, I'm whole again. I just don't think that that's realistic because it takes so much discipline and so much work to be sober and to get into a routine where your life is like, this is my life and not what it used to be. And that's the really hard work that people have to do.
Yeah, yeah, yeah. Agreed. I don't think psychedelics is the solution, but the one that's becoming actually that I hear the most about is the ketamine.
Yeah.
That is getting really popular. And I'll tell you, people do not realize how significant those health concerns are.
Yeah.
Um, the bladder,
Gosh.
the urinary tract, they're coming in and they're having to urinate every 15 minutes
That's scary.
and their bladder shrinks.
Mm.
So, and then of course there's other complications that go along with it, but it's a very addictive drug. I mean, it does give you a sense of euphoria.
Right.
So, and people can get it like in a nose spray, and basically they're
Jeez.
spraying it all day long, getting these euphoric experiences, and then they
Oh,
become
wow.
addicted to it. So, not only does it not treat the depression, at least effectively, in my opinion, but it
Mhm.
causes all these secondary issues.
Right.
So, I mean,
Jeez.
it blows my mind that ketamine is legal, actually.
Because it hasn't really been around that long, like maybe 10 years, I think.
Yeah, I don't know when it was first created, but as far as it being legal, probably about 10 years.
Yeah.
I mean, you can walk in. I mean, there's clinics I don't hear all over California where you can just walk in and get ketamine.
That's insane. I
Right,
did not know that.
right. Right.
Don't do drugs, guys. This is the moral of our story today.
Yeah.
Um, Let me ask you, what is something that you would really, really want people to know about if they are struggling with addiction and they're just like, I can't quit. I just can't. I just don't have it in me. I'm not strong enough. Like, what is something that could really help them maybe
The
make that
most
first call?
important piece is getting to why they're using it. This is paramount. Why did they go to it in the first place? Why do they feel like they need it? Are they suffering from depression, anxiety, trauma, low self-esteem, stress? Um, they really need, once you understand the why behind it, just understanding that one piece can be very freeing, because it gives you a deeper understanding of like why the addiction is there in the first place. And I recommend to people, I mean, if you can't come into treatment, at least start working with a therapist like on a regular basis. But I will preface it that if you're addicted to something and working with a therapist, it's kind of difficult to process emotions effectively because you're self-medicating still. So the benefit of coming into Passages and doing all this therapy is that you're sober, so you're able to process more
Right.
effectively.
Right.
But really just getting to the why behind it is key.
Yeah.
It's so important. And this is being missed in a lot of treatment centers. They're not talking about, they're more focusing on it as it being a disease and that, you have to manage it.
Mm-hmm. Mm-hmm.
Um,
Mm-hmm.
and I'm a big advocate of one-on-one therapy. Groups are okay, but really private one-on-one with a great therapist.
I think that is such a very important point because this is something I get kind of mad at in my field is that, and this is truly an insurance thing, I think. A lot of therapists were like taught to be very solution oriented, kind of like get people out, like don't dig very deep. But I am certainly the therapist who's very much leaning into like IFS and psychodynamic. Like I want to go down deep in there with you. And I feel like I wish more therapists would do that. So to add to what you're saying, find a therapist who will go deep with you, who's not like, great, you're good. It's been 4 sessions. You're fine
Hmm.
now. Like look for someone who's going to ask you the really hard questions and really dig in there with you.
And oftentimes it goes back to childhood.
Mm-hmm.
I
Always.
mean, a good majority of the clients that come to Passages, they're dealing with childhood trauma,
Yeah.
and that's affecting their adult life.
Yeah.
So I really recommend people going back, working on the trauma, releasing it, processing it, letting it go. Um, and that's why I think working with a therapist, over a period of time versus just doing like a psychedelic that happens for a day, I'm, I'm more in favor of the therapy route personally, but
Same. Go
yeah,
therapists.
yeah, absolutely.
Well,
Yeah.
Pax, it has been such a joy talking to you. Tell people how they can find you.
So yeah, passagesmalibu.com. Just go to the website. You can call our number, and or I can give you the number. It's 310-589-2880.
And it will
And
be
they
in the
can
show
actually
notes.
ask to speak with me.
Oh, how
So I take
cool.
admission calls at Passages every day. I work with families that are trying to get their loved ones in, or I work with the person who's struggling with the addiction. But all they need to do is call and ask for me or ask for admissions.
That is so cool. All right, you
Yeah.
guys, that's going to be in the show notes with links so you can just hit those quickly if you're like, okay, it's time.
Yeah.
Thank you so much, Pax. It's been a
Yeah.
joy.
Thank you, Jackie. Great talking to you. Take care.